Yeah, so thanks for that, Michelle and Heather. Um, so actually, 2 days ago, when we had this discussion and preparing for this meeting, we were talking about why is teamwork really important, or why should we be talking about this at this time? And we're reflecting on, the old way we used to approach, primary care, the way we used to approach looking after patients, and the new way, what the new way really demands of us. And we came up with a few ideas that really gone are those days where a primary care physician will say, "This is my patient. I make all the decisions, looking after this patient." And I think that was a mental model we had several years ago. Maybe in recent years, the way we've been thinking will be, this is my patient. I involve you. I involve the CDM nurse. I involve the MOA and things like that. What we think the environment is asking of us now is thinking like this: this is our patient. We work together to meet the needs of our patients. And the reason for that is because times are changing quite fast, and not only changing, they are really unpredictable. Our patients are becoming more complex. The expectations are higher. We know that two heads are better than one, for many reasons, different perspectives. Sometimes when I see my patients, my perspective is a little different from my chronic disease nurse or my MOA. And when we're able to bring all those ideas together, it's easier for us to make a more effective, not necessarily efficient, but a more effective decision for our patients. So the truth is, if I often say this, and I can't remember who actually quoted it. I think it was quoted in South Africa. That if you want to go fast, go alone, but if you want to go far, go together. So there's more emphasis today, definitely, on the importance of teamwork. And as physicians in most of our clinics, we are the team leaders. So that's one of the reasons why we are discussing this today. I'll give you a quick example. We have 6 staff in our clinic, and 3 of them are out currently due to COVID infection. So today is Wednesday. In the past few days, or about a week or so, we've had only 3 staff working with the physicians. How are we able to do that efficiently? How are we able to easily redistribute the work, the workload amongst just 3 staff? Is because they work, significantly cohesively between all of them. So teamwork is going to be very, very important moving forward for us in the current climate. Next slide. So yeah, this is a good question. Actually, the first thing that comes to my mind when I think about it is teamwork really, really necessary. I think about my marriage. Is teamwork really important? How important? I mean, is it really necessary? To be honest, that question depends on a lot. The answer to that question depends on a lot of things. It depends on the task ahead. It depends on the required duration of collaboration for the team. Next, you can click next. Yeah, so interdependence is something that is definitely required for a team to work together effectively, not just efficiently. And like I was saying, it depends on how long the team would have to work together, whether in a PCN board. You all agree that the kind of interdependence that is required in a long-term relationship is different from the requirement. If you are attending, for example, just a conference, just a team of people, or you have just 3 months to collaborate with people in a committee. So is it really necessary? In most cases, and I think at the end of the day, it really depends on how far you want to go. Again, going back to what I said, If you want to go fast, you can say, well, yeah, I'll do my own thing. You do your own thing. Everybody just, everybody knows their responsibilities, but if you really want to go far, most of the times, interdependence is required. Synergy is required. Seeking win to win, win-win is required in an effective team. In an effective team, it's always important to learn the skill of seeking, how to seek the third alternative, how to listen well to other people, how to value the difference in a team environment. Next slide. So these are examples of places where you would find teamwork needed in a clinic environment. And it depends on your position in the clinic, whether you're a clinic owner, you're an associate, or you're just, kind of paying overhead. The PCN board committees, and sometimes even on zonal level, if you are leading other physicians, or even provincial level. The fact is that all of us as physicians, we are leaders at one level or the other. And this is one opportunity for us to actually reflect on who are the people I'm leading and how well am I leading them. Next slide.
All right. Well, thanks, Joseph. So, so this next part of the session, the three skills that we're going to talk to you about are based on the work of Eduardo Salas. And he's an organizational psychologist who did a lot of work with military and aviation and medicine, looking at highly complex work and the teams that do that work. And they identified that there are 7 drivers that are in play when there are highly effective teams. And they distilled those down into conveniently 7 C's. And today, we're not going to talk about all of them. We're just going to touch on 3 of them: cooperation, coordination, and cognition. And we're also not going to go deep into all 3 of those. We're going to talk about supporting psychological safety in cooperation, making huddling and debriefing routine within coordination, and then in cognition, talking a bit about sharing the vision. So that is our plan. And again, these are by no means, the only important skills for leading teams, but there are 3 that are kind of foundational. And if you can just start adding these, we know your workloads are very heavy right now and things are fairly complex. So even if you start just thinking about these and starting to take steps to add them into your day, over time, you'll see things will start to change. Right, so a skill testing question for you to get started. So we have 2 teams here. So I'm going to describe each of them. So team A is very organized. They start their meetings on time. They end their meetings on time. When they speak, if somebody is an expert in an area, everyone politely listens while that person shares what they know about that area of their expertise. There's no idle chit chat. They stick to the agenda, and their meetings are very efficient. Team B starts a little late because there's a lot of idle chit chat to get started. They are on the agenda, but then they veer off on bunny trails, and then they come back to the agenda. There's a lot of laughing. They will sometimes finish each other's sentences. And at the end of the meeting, people hang out and chat for a little bit longer. So it seems much more sort of informal. Now, one of these teams represents what highly effective teams look like when they meet. Which one do you think? So you can vote in the chat box. Team A or Team B? Which one is highly effective? We have a few opinions. B seems to be leading the show. A few A's. Okay. Yeah. So it depends on the nature of the issues. Potentially, yeah. Yeah, so we've got a few votes for A, lots of votes for B. Well, the answer actually, Wayne, you nailed it. Yes, Team B is more effective as there is an undercurrent of trust and connectedness. Yes, yeah, exactly. So, so this is really speaking to psychological safety. So Team B has very high trust and psychological safety. And that has been determined to be one of the most critical aspects of a high functioning team. And so just so we're all on the same page, psychological safety is a belief that one will not be punished or humiliated for speaking up with ideas, questions, concerns, or mistakes. And it's the work of Amy Edmondson. She coined the term many years ago. She works at, I think it's Harvard. And it was interesting in her original research where she discovered and coined the term psychological safety. They were looking at hospital teams, and they had this prediction that the highest functioning hospital teams would have the lowest rates of medication errors. That was what they thought they would find. But it was actually the reverse. There was a very strong correlation, and it was the reverse. The highest functioning teams had the highest rate of medication errors. And so that was very perplexing, that data. So when they dug into it deeper, they found they weren't, in fact, making more errors. They were just reporting them. They were bringing them out into the open because they saw errors as an opportunity for everybody to learn and everybody to grow and to prevent that same error from ever occurring again. Whereas the lower functioning teams were hiding the errors because they didn't have that confidence that they would not be shamed or blamed for bringing an error forward. So this is what we're talking about when we speak about psychological safety. Now, Google also did an extensive look at what makes a team effective. They, of course, have lots of teams, and they spent 2 years and they looked at 180 of their teams and 37,000 employees to try and see if they could isolate what was the secret sauce in those teams that were functioning so highly and were so effective, and those teams that absolutely were not. And they discovered something similar in their end results. They found that there were 5 factors that were present in those highly functioning teams. And they were dependability. So people felt like they could depend on each other. The teams had a strong goal structure. They all knew what they were getting at and were very clear on what the goals were. They had a sense of meaning in the work, that what they were doing was important in the world, that they were making a difference. That they were making an impact. So the meaning one was more about that it was meaningful to them personally. And then the 4th one was that it was impactful in the world. And then the 5th one was psychological safety. And it was far and away the most critical factor in all of those teams. It blew the other 4 out of the water. They were important, but psychological safety was absolutely the most important. So we know then why we need to think about psychological safety and building it in our teams. It promotes teamwork. People are much more innovative when they feel safe, when they can trust the people that they're bouncing ideas off of. And it increases learning and growth for everybody on the team. So how then can you start to make sure that your team is always building and supporting psychological safety? So as a leader, you can start to create that safe environment. So when something does go wrong, it's really important that everyone observes that that person isn't shamed or blamed, that it's brought out into the light for everyone to see in a kind way, in a way that is intended to help everyone learn. What can we learn from this event? How can we make sure that this doesn't happen again? And it's about the event and not about the person. And you can also make it safe by by ensuring that everyone's voice is heard. So if you are in a meeting, whether that's, a PCN board meeting or a meeting in your clinic, that you're actively asking to hear every voice, not just hoping that people will speak up, or allowing some people to stay quiet because perhaps they feel they're lowest on the totem pole. And another important aspect is to model your own fallibility. So saying things like, I need your help. I might miss something. Please let me know if you see that I've made a mistake or that I've missed something in a chart or in patient care, whatever it is. When you model that, you're setting the stage as a leader. People are looking to you. The third one is to embrace the messenger. So when someone does come forward and comment that they've noticed something that maybe you've missed, make sure that you embrace them for that. Thank them for their feedback, thank them for their input. And again, others are watching, and when they see it happen with someone else, they'll be more inclined to do it with each other and with you. And then the last one, and probably the simplest, is just to get to know people. And again, this doesn't need to be onerous. It doesn't need to be another task you have to add to your list to have, long conversations with people. It's just really little touch points. When you see someone in the morning, how are you doing? How's your day? Just trying to get to know people as much as you can. All right. I just see there's something in the chat box here. Oh, Wayne. We've used a check-in technique where each person in the meeting shares something, can be anything. At the beginning of meetings, I find that if each person contributes, shares, and builds safety in the meeting, it has been used in great effect in a few pivotal meetings I've had. Oh, that's wonderful. Thank you for sharing that. Thank you. Yeah, that's a great example of what happens when that trust and psychological safety is there. And yes, Heather, Zoom is a whole different beast. It's very difficult to create psychological safety in a team when you're on Zoom, but there are definitely ways to do it. And I would say, just like Gwen was talking about, perhaps building in a part at the beginning of the meeting to kind of get to know people a little bit. Great. And this is just a little bonus tip. Beware the HIPPO effect. So HIPPO stands for the highest paid person's opinion. And so what tends to happen is, if to be made, people will just automatically look to the highest paid person, which is often the physician at the table if it's a clinic team. And if they express their opinion first, people will just adopt it. Like they often won't challenge it. Oh, where did you get that? HIPPO so fast, well done. So really, as a leader, when you're in a room and you know that there is a bit of everyone's not on the same level, asking for everybody else's opinion before you express yours can help to again create psychological safety, and also get a variety of opinions that you can choose from. And sometimes you get some really good ideas that way. All right. So we wanted to open the floor up for this section. We'll open it up after each one to share your thoughts and ideas. And we've had some great ideas already. Thank you to Wayne. And any other thoughts, if you want to just come off mute, that's great. Give us your tips. I know we were talking before the session. I know Rob and Michelle Warren, you've given a lot of thought to how you work with your team. And I know others of you on the call also over the years have worked at creating a great team environment. And again, thinking about those who are on boards, on your PCN board or on committees, what have you seen that works or doesn't work? And some tips that you might have to share.
It's Wayne here.
Hi.
Good morning, everybody. One thing I found is that the size of the team matters. So make sure you don't make it too big. You want sort of a half dozen-ish kind of numbers, because this way everybody's allowed to contribute. One person doesn't check out and not contribute. You get a diverse set of opinions. And also, I really like using the check-in technique, because you also have to recognize on your team, you're going to have some introverts and extroverts. And it's, tapping the talent of some of your introverts, is because when they say something is usually quite insightful. So yeah, that's what I found.
Yeah, great comments. And we'll find the things kind of commingle that were the three skills that we're talking about. And Joseph is going to talk about huddles in a bit. And that's a great way to kind of also have a check-in with your team. Anne.
Morning, everyone. Sorry, I've got a little guy beside me here.
Oh, morning.
So a little distracted. I have a couple of things. I think when certain teams get to a certain level, the debriefing aspect is really important. Just sharing some experience in the clinic that I work at CUPS. We're a fairly large team with multiple disciplines and specialists and things like that. But we have started to chat with a group, which is an Emerge doc, who developed this tool called Info Debrief. I can put it in the chat.
Thanks,
and it's being used by AHS in emergency departments, and I think they've scaled it up to being used as kind of a standardized, formalized way for clinical teams to debrief after like a serious and maybe even not so serious event. And I think when you start to make those types of processes standardized in the way that your clinical teams practice, then that psychological safety then develops really nicely, because then it's, not such a big scary thing anytime something adverse happens, and you can debrief about it as a team in a formalized way, where you're not putting blame, but you're really looking for that quality improvement aspect. So I can put that, and they're able to do the training as well. And we've done a lot of the training for our leaders to begin in our clinic through Zoom, and then they can come in and do some train the trainer type of things as well. And as you kind of scale up to including all of your other team members. And the second thing I want to say is, I think one of the challenging things, especially in huddles that I've experienced, and especially as a leader, is that when you have team members go a little bit rogue, right? And maybe someone who's just not as, in tune with the theory, with the concept of psychological safety and things like huddles and things like that, where they, a person may come out and criticize somebody else, right? In the meeting. And so my question, and maybe some experiences from others, is like, what can you do as a leader to either mitigate that or respond to that either in the huddle? Do you respond to that in the huddle, or do you kind of do something after the huddle to speak with the person? So I found that kind of it's awkward, I'm saying, when that happens in a meeting, and some strategies for that. Thanks.
Yeah, thanks, Van. I mean, to be honest with you, we could do a whole session on psychological safety. It is a deep well that we can plumb. I guess the thing to remember with psychological safety is whatever is happening between the leader and one person is being witnessed by everybody. And so those interactions are important. So I would say probably what you said, both. So you definitely don't want to let it go, because people are looking to the leader to see, oh, what are you going to do about that? And if you do let it go, then they start to feel unsafe. So I think maybe a gentle comment in the moment, and then also definitely speaking to that person behind the scenes after, again, without blame or shame, but just helping them to understand. Sometimes people don't realize the impact that their comments have on others. And it is complex. It's very complex. And this is probably the part you're like, I didn't sign up for this when I went to medical school. This is not something that I thought I was have to deal with. But sometimes having a really great clinic manager can be a great answer as well. And then some of those more challenging aspects they can really help you with. Heather, I see your hand up.
Thanks. So I've got a story of positive, and then I also have a story of not so good. And I guess I kind of want to ask a question about how to identify the not so good. So the story of good is our PCM board had a really high charged conversation about a vaccine policy for the organization. And so as you can imagine, there was a diversity of thoughts. And the conversation was, I guess, heated, but I was quite pleased to see that it was done so in a respectful manner. And coming out of that, after we had made our decision, regardless of what side people aligned, we were able to come back and speak as one voice. That, you know, we made this decision, and, you know, there's an understanding that we might not all agree with the decision, but our job is to speak with one voice. And as I look back on that, I think the reason why we were able to do that is because we had psychological safety, that we were able to really dive into this issue and explore it, and to be vulnerable in those conversations, and know that we weren't going to be judged. And so that's my story of good, where things have worked well. And then my question is, my mom used to be a teacher, and what she would say is that in a classroom, oftentimes there'd be kind of ruckus and stuff with the kids. And she says, you know, sometimes it'd be difficult to understand who exactly was the driver in that situation. And then sometimes a kid would move, and all of a sudden the dynamics would shift. And she'd be like, oh, I didn't think it was X who might have been the driver in this situation. And so, you know, I'm just curious as to, are there ways that you can maybe see or identify perhaps somebody who is eroding that psychological safety, like some of those warning signs, and how you would maybe take action?
Yeah. Wow. I don't have an answer for that one. That one, I don't know. I will, I think, be consulting some teachers, because I'm sure that they, over the years, have witnessed the dynamics in the petri dish that they're in. But if that's an area of interest, like, again, psychological safety is a huge field of study. We can definitely have another talk on that. Oh, and Brad, maybe you've got the answer.
I don't know if I have the answer, but I have a answer. I mean, you know, when you're in a group and over time you have a person that's actually withdrawing from conversation and not contributing, the other behaviors you see is that they're critical of others' opinions, you know, out of the gate. They are inflexible kind of in their thinking or reaching a group mindset. They're dismissive of other people's ideas, and often harshly critical of other people's work as well, without proposing any solution. You know, those are the types of behaviors that I've seen in teams that actually erode psychological safety. And then the trick is actually trying to figure out the why. I actually think that's the harder point, because I've had situations where it's actually a colleague in burnout or in their own, you know, emotional issues or family related issues, and that's what's driving their behavior, and they're not intending to do that, but it's a byproduct of their own psychological state. Yeah. And, you know, then I've also had had situations where it's because someone doesn't want to be there anymore, right? And they're just not kind of willing to address that issue. So, you know, I think the behaviors, Heather, are easy to see, but it's the getting to the why those behaviors are present that are hard. And then if you can figure out the why, then the hardest is dealing with it. Because sometimes it means parting ways with a team member, or parting ways with a friend, which is a very difficult thing to do. Or sometimes it means that a person needs to step back from the team or step back from their leadership role to work on their own mental health and well-being. And so figuring out the why and how is harder, and then how you manage it is the, you know, I think the hardest. And I've had to do that a number of times, and, you know, and it's never easy. Those are actually some of the hardest things I've had to do in my career.
Yeah. Thanks, Brad. And it's interesting, as we learned in one of the last sessions, one of the three components of burnout is cynicism. And I think when you start to see that showing up, it can be a double whammy with the team's psychological safety and then the person's own health and in being in burnout. So, yeah. All right. Well, I'm looking at the time. And again, this is good, though. Obviously, this is a topic that maybe we should go a little deeper into another time. So we'll make a note of that. I'm going to pass it back to Joseph to bring us to coordination.
Yeah, so I think I'm just going to go through this quickly because of time, because we want to do want to go into our breakout sessions. Yeah, huddles and debriefing, I think they are really, really important. They are extremely valuable touch points, in a team. And I was actually just thinking about this morning. I think what I found most important in touch points is the individual components, really just connecting with individual people. And I agree with you what you said, Wayne, that people have different temperaments and personalities. There are some people you can't really get them to talk openly in a team, and it's important to to connect with those people, privately sometimes, to actually get the ideas, because the ideas are important to the effective working of the team. So just giving you a quick practical example, in our own clinic, some years ago, we did the phase 1 and phase 2 PMH, patient medical home assessment. If you haven't done that, I would encourage you to look at it on the ACTT website and just do it for your clinic, for your team. And one of the things we learned from that was actually, creating a dedicated time for teamwork or QI meeting in your clinic. In a time when all the phones are dead, the only thing you do is just kind of meet together and just talk about what's happening. So in our own clinic, we have every Wednesday from 3:30 to 4:30 that we meet as a team, and we call it QI meeting. And the phones are dead, doors are closed, and we just want to see what's been happening the past 1 week. What are the TNAs like? No-show rates, what are they like? How is our screening like? How is everybody doing? What's happening? How can we redistribute the work? Which doctor, is behind? What are the what's access like, and all those things. Panel sizes. We just, discuss a lot of things, and we talk about QI projects that we are doing as well. Okay, at what stage is this? What is, conflict management? Talking about CIC part now, mismatch and all that. Just go through all those things. So it's a very important touch point as a team. Also, the girls do huddles every morning. Everybody's standing. Just talk about what's happening today. For example, I talked about 50% of our staff being down due to COVID. It's at huddles. You talk about, okay, well, how are we going to run today? What's going to happen? Otherwise, there's going to be confusion throughout the day. And then, in addition to that, we encourage all our MOAs to connect with their primary care physicians every morning. So I have my MOA will come to me about 2 minutes before I start. Sometimes 8:45, or even 8:50. Oh, your day is going to be nice today. Your day is going to be beautiful today. Then I know it's going to be beautiful if she says that. If she comes and say, well, Dr. Joe, today I'm not sure what's going to happen, then I know it's going to be a long day, because she has come through my schedule. She knows the complex patients, their levels of complexity, time allotted to every patient, all those things. So those kind of touch points are really important. And you talk about debriefing. Debriefing is important. Sometimes on the corridor, just to quickly talk about what's working, what's not working. Is it time to quickly, express your mood, your frustration, your happy moment, all those kind of things to people are working with you. So it's a culture. I would say it's a culture of continuous improvement. They want to create in your clinic or wherever you are leading people. And I want to say, next slide, I want to say really the time and what you do at huddles and when you're debriefing are not nearly as important as how you communicate during those times. So really, it's not what we do, but how, and how you share the information, how you express yourself, like Brad said, how you listen to other people, how you communicate yourself with empathy, how you seek a win-win, how you look for the alternative. Those are the real things that make a huddle debriefing. Otherwise, huddles can become a chore where people don't really look forward to it, because they feel, oh, I'm not looking for, I don't know what's going to happen again. What did I do wrong? That kind of thing. So next slide. Yeah, so I think I talk about this quickly. You know, no shame, no blame. Make it really official and make it very brief, and people will actually look forward to it to plan their days. Next slide. So if you have any quick ideas or questions about how you do huddles or debrief with your team, I think this would be a good opportunity to share that.
Just give people a moment to, oh, there we go. Rob.
Yeah, Rob.
Hey, good morning, everybody. Rob Warren. I'm a family physician practicing in Sundre. We started our own medical clinic just about 8 years ago. And my story about huddling is how huddling never ever worked for us. It was a great idea in theory. We thought about having morning huddles before we started work. But the problem was we were never all together on the same day. And our team was never all together on the same day. What did end up working for us was actually an asynchronous, ongoing huddle using an app. We brought an app into the clinic. It's called Slack. And you can create different channels on it, everything from like really serious, this is information the whole clinic needs to know, to fun stuff, to sharing memes or jokes or anti-mask stories or whatever it is that we all need to connect over. And we would never go back. So just throwing out an idea that if in-person huddling doesn't logistically work for you, this was a solution that really worked for us and that accomplished, I think, the same thing.
That's really very cool. That's actually the app we use in the North Zone as well, for all the physicians in the North Zone. And the PFs are included in that as well. And we have different channels, and it's so good. It's so cool because you can share all kind of files, videos, and people can always go back to. New members can join. They can see what the conversation has been like in the past few years. Very good.
Janet.
Yeah, I was just going to say, I don't think a huddle necessarily has to be the whole team. I often huddle with just my MOA for 1 or 2 minutes and just the reception staff for 1 or 2 minutes, just to go over, how many more patients can I fit in today? What equipment do I need? Who needs some prep before I see them? Those sorts of very practical things. So it's not a whole clinic huddle. It's just me with the staff that I'm working with that day and what my needs are and what they can do to help me.
Yeah, it's a really good point, Janet. I think the key is that it has to, there are no rules about this. It has to have utility for you. We don't want you adding things in that are just adding more to your day. If it doesn't give you something really important back, play with it until you find what fits for you. And maybe it is something like Slack, maybe it is smaller huddles, maybe it is a formal whole group huddle. Experiment a little bit and see what gives you that opportunity to connect and get your day organized. Right. Shall I move us along, Joseph?
Yeah, let's quickly before. So the last one there is share the vision, cognition. I think this is actually important. The first thought actually that comes to my mind was, Michelle, one day you asked, it was a few months ago, I think it was last year, when you asked me, I remember I was driving and we were talking, so what's your vision, as a physician leader in the North Zone? I was like, okay, all right, what's my vision? I think I told you that day. And your comment was, your vision should be so clear that you can articulate it in just few words. And I think that's really important for every leader. To know what your vision, what your purpose. Your vision really is the compass, that takes you to a predetermined destination. And then that's something you should not only be able to articulate easily, you should be able to share with your team members so that everybody's kind of on the same page. So sharing your vision, your purpose, your priorities, why you're doing what you're doing, I think it's extremely important, because when people understand why you're doing what you're doing, you'll be so amazed all kind of ideas or kind of initiatives are going to be coming out of without you prompting them. And I think that's the most important duty we have as a leader. Not just telling people what to do, but telling them why and where we're going first, where we're hoping to go, and why it's important to go there, and just then leave the rest to them. So there should be a lot of, plenty of opportunity for us to do that. Sometimes do that, in a debrief environment. Sometimes, just like Janet said there, what's my day like today? How can I add more patients? Or I have more space today, or I can do more today. Or tomorrow, block me out for, that's kind of a quick, you have a vision for tomorrow. Like my MO would come to me on Monday morning, Monday afternoon. Do you have a meeting tomorrow? Should I block you off? That kind of thing. She's trying to see what my next day is going to look like. So it's important for us to know what our visions, our missions, our values are as leaders, and to be able to communicate those things clearly. Sometimes you have to, you have to do it over and over again, because it's one thing communicating, is another thing for people actually getting it, understanding it. Sometimes in our team, in our room, we actually have a whiteboard. You write it again, you talk about it. And sometimes you actually, we've had to send some of our MOAs to other clinics before, just for them to get the concept of patient medical home. We've had Brad, who sent to one of our MOAs to your clinic before, to come and look at how you guys are doing things. So communicating that vision, can happen at different levels and different ways. So does anybody have any ideas and thoughts about how to communicate or share vision?
May I just say something? So I think the key word that I'm seeing there, Joseph, is share, right? Which to me speaks to collaboration. And again, speaks to what you said at the very beginning, which was there's the old way of doing things and there's the new way of doing things. And the old way was, I'm the boss, I'm in charge, you follow me. And the new way is we are a team and we are working together to support the patient. And so I think that the share the vision needs to be similar, where you have the team gathering together, collaborating, and shaping and forming that shared vision, as opposed to it just being placed upon them. Like, this is where we're going, please follow me.
I know I'm always amazed when I work with different clinic teams. You think that, your family practices, you think your vision would all be the same, looking after patients. But they're always different. There's always a slightly different flavor. There's something that's important to each unique group of people that come together to work in a clinic. And if you can really harness that and use it as something that brings the team together, and if everyone is again aligned and moving in the same direction, it can give people a real sense of purpose and joy in their work. Anyone else have thoughts? Do you all have visions that you can articulate easily? Mary?
Yeah, I just wanted to say, in our clinic, because the clinic's been around for a while. I'm at Cold Lake First Nation, but we have just changed a lot of things here with hiring me on full time. So I'm the first time that they've had a clinician there for a long period of time, or for full time. Usually docs would come in a couple days a month. And so now I'm here all the time. So we have actually started talking about this and how can we start discussing what our vision is, what our mission statement is. So I'm using all of these things from these meetings to bring forward. So we just talked about bringing in a consultation person who's going to do some consultation with us and helping us bring all that together. So we're at the very beginnings of it. So I'm hoping to learn from everyone.
Yeah, that's wonderful. That's great. And if I had one word of advice, it would be make sure, like they can get pretty verbose. Try to keep it short and snappy and meaningful so that everyone can remember it, just flows off the tongue. And that way it has some utility for you. But we'd love to hear what you come up with if you want to share.
Yeah, over time we'll share for sure.
Yeah, wonderful. And I see in the chat here, we've got Chris, working out how to deliver the vision to the wider team can be as important as the vision itself. Hallelujah. Yes, yes. And I know a few of you have, you've got something up on your wall. You've got like it's there for everyone to see, including patients, which I think is also a really interesting approach. But it's like anything, if you don't bring attention back to it, becomes part of the furniture. You know, you just blend, you don't see it anymore. So how do you keep it alive? How do you use it in your huddles and your meetings? Brad, would be great to include the community in the generation of the vision. Oh, wow. Yeah. Like patient advisors and an interesting approach. Yeah. Great.
So our next session is in March. So we'll see where we are then with respect to COVID. And so our topic is I'm okay, you're okay, techniques for managing conflict. And again, please fill out your evaluations. We really do utilize that feedback. And thank you guys so much for attending and all the great conversation today.
Yeah, thanks everyone. I think we could have gone for a couple hours. That was really great conversation and participation.